Drugs on Sex presents Depressants. This podcast will focus on alcohol.
So what are depressants?
Depressants are drugs that inhibit the central nervous system, causing symptoms like relaxation, drowsiness, and decreased inhibition. They lower the levels of awareness of the brain. How do they work?
Most depressants function alongside the neurotransmitter GABA. GABA is the most spread inhibitory neurotransmitter in the brain. Depressant drugs act as an agonist for the neurotransmitter GABA, meaning they stimulate its action. Because one neuron connects with thousands of others, the inhibitory neurotransmitters in one neuron decrease the responsiveness of other neurons, causing inhibition of the central nervous system. In other words, the stimulation of GABA causes brain activity to reduce. Some examples of drugs classified as depressants are alcohol, barbiturates, and benzodiazepines. Today, we're going to focus on the most popular depressant consumed by university students, alcohol, and how it could lead to risky sexual behaviors. In the brain, alcohol does not only stimulate GABA receptors. Alcohol increases the function of neurotransmitters that inhibit the central nervous system and decreases the function of excitatory neurotransmitters that stimulate the nervous system. Neurotransmitters, such as glycine and adenosine, would be considered inhibitory. Other neurotransmitters, such as glutamate and aspartate, are considered excitatory.
Additionally, alcohol affects the action of neurotransmitters from the opioid family, which have an analgesic effect in the nervous system that leads to an increase in levels of the neurotransmitter dopamine, released in the nucleus accumbens. The nucleus accumbens is a region of the brain associated with rewards. Its stimulation explains the euphoria and desire after drinking at a party.
What effect does this imbalance have in other brain regions?
Imbalance of the central nervous system caused by the imbalance of neurotransmitters impairs the function of certain brain regions, such as the hippocampus. The hippocampus is in charge of memory. This explains why, the day after being very drunk, we may have some blackouts, because our hippocampus was not able to form a memory. Additionally, this imbalance affects the prefrontal cortex. The prefrontal cortex controls impulsivity, attention, and problem solving. Alcohol causes the prefrontal cortex to function as if it was damaged, losing control over our actions and ultimately impairing our ability to consent to engage in sexual activities. How does alcohol influence behavior?
Some functions are impaired with alcohol consumption, such as perception, motor performance, and inhibition. Alcohol consumption causes less blood to reach the cerebellum, impairing its control over voluntary movement and coordination of movements. Alcohol can cause you to lose control over behavior and do things you might not typically do. It is common to disregard personal risk and ignore long-term consequences, focusing only on immediate rewards and pleasure. We are unable to stop this inhibited behavior because alcohol affects the frontal cortical areas and the striatum, causing decreased control of motor functioning. After seeing the effects of alcohol in the brain, you might be wondering, how does alcohol relate to sex?
As alcohol is an inhibitor of the central nervous system, it slows body systems, including sexual functioning. Small amounts of alcohol can enhance sexual desire, arousal, and performance, whereas large amounts inhibit functioning. This presents a curvilinear effect. At first, alcohol enhances sexual intercourse until its increased consumption reaches a point where it impairs sexual responsiveness. Studies show that when people consume alcohol, they feel more attracted to others, and report higher social outgoingness. The possibility of intimate encounter is higher when consuming alcohol in comparison to other drugs. This can also lead to an increased chance of post-sex regret, because people often feel less attracted to their partner after the effect of alcohol wears off. The perceived effect of alcohol during sex differs according to expectancies. If someone expects that with alcohol they will enjoy sex more, they report more arousal. For instance, in post-drinking self-reports, people say sex on alcohol endorses more enhancement and disinhibition during sex. Consequently, our beliefs of the effect of alcohol on sex encourage us to drink. Binge drinking, specifically, is associated with higher sexual expectancies.
In relation to the pharmacological effects of alcohol, the outcomes are very different. Studies show that in males, alcohol leads to orgasm delay, ejaculation failure, and suppressed penile tumescence, which is the normal temporary growth of genitalia due to increased blood flow that allows sexual functioning. Females also experience delay in orgasm and a decrease in vaginal blood volume. Other studies show that compared to other drugs, alcohol during sex decreases sensitivity, sexual enjoyment, and orgasm intensity. In addition, males report sexual dysfunction after alcohol use, while some studies have related alcohol use to vaginal dryness and painful intercourse in females. Even though many studies promote that the use and abuse of alcohol is a good predictor of risky sexual behaviors, some participants have reported no significant relationship between drinking and risky sexual interaction. Intoxicated people also undervalue the consequences of risky relationships. This shows us why it is so important to be aware of our alcohol consumption, as being intoxicated can subject us to unintentionally making harmful decisions. So how would you explain this relationship?
The relationship between alcohol consumption and engaging in risky sexual behaviors is explained in Steele's alcohol myopia theory. The theory suggests that alcohol affects perception of instigatory cues, in this case the arousal of the moment, and inhibitory cues, referring to the knowledge of being in risk of acquiring sexual transmitted infections, also known as STIs, having unprotected sex, etc., causing people to perform sexually risky behaviors and ignore the actual risk. The research also shows a positive correlation between seeking for sensory behaviors, arousal, desire, and inconsistent condom use when consuming alcohol. Sexual activity can become more risky depending on the individual's partner and the relationship. With casual partners, we are less likely to use condoms, while with steady partners, our use does not vary much from sober. Studies also suggest that greater intoxication levels are more frequently reported by people engaging in sex with a casual partner.
Alcohol consumption does not always lead to risky sexual behaviors, but there is a positive correlation between the two. For instance, more research shows that a relationship between alcohol and being in situations that expose people to unwanted sexual situations and sexual assault. The use of alcohol in sexual contexts can actually contribute to outcomes such as sexual harassment. Research findings suggest that alcohol contributes to sexual assault. In reports of college victims, 55% were under the influence of alcohol. The reason for this is likely attributed to the perpetrator's decreased ability to identify when they should stop their advances, if they're under the influence of alcohol. As well, the victim typically views the situation as less risky and is even less likely to resist when under the influence of alcohol.
So does this mean you can't consent to sex when under the influence of alcohol?
Actually, in Canada, there is no law stating that an individual cannot consent after consuming alcohol, although the individual's decision-making may be impaired. As long as both partners willingly and verbally agree to the interaction, this is considered consent. The issue arises when an individual is coerced to agree or is unable to agree, perhaps due to overconsumption causing the consumer to become sedated. If this is the case, then consent is not valid, regardless of the amount of alcohol consumption. So how does chronic alcohol consumption affect sex?
Long-term alcohol toxicity is associated with decrease of erotic sensitivity and impairment in the sensory afferent pathway, which is the pathway that receives messages from the outside environment. Impairment of autonomic nerves also affects erection and ejaculation. In males, testosterone levels are also affected, causing a decrease of sexual interest and could even lead to testicular atrophy, whereas females are affected by lack of orgasm and lubrication, painful intercourse, and can even develop ovarian atrophy.
Overall, sex on alcohol has both psychological and pharmacological effects, but it depends on factors such as expectancies. Alcohol consumption can also lead to risky sexual behavior, such as exposing yourself to STIs by not using condoms, and increase accounts of sexual assault due to the individual's inability to consent or realize what they're engaging in.
Nevertheless, it's not always a dead end. Small amounts do help in sex. The problem is, inhibition and sedation do not allow us to consider the negative consequences, which can lead individuals to engage in risky sexual activity.
Thanks for listening. Stay tuned for our next podcast highlighting the stimulant drugs, cocaine, and amphetamines.